Okay, neoplasm. It's just part one. Obviously, there's part two. Neoplasm. How do you guys understand neoplasm? What is neoplasm anyway? Neoplasm. It's such a big clinical word, right? What is neoplasm? It's Manny says it's a tumor, right? Okay, it's a tumor, right? It is a tumor, right? Well, neoplasm actually is a fusion of two words. Arthur, yes, cancer. It is also cancer. When we talk about tumor, first thing comes to mind is it is cancer, right? So it can also be cancer, right? So neoplasm actually is a combination of two words. Neo means new, and plasm means growth. Okay. And matter of fact, new growth or abnormal tissue, okay, is starting to has started to pop up, right? That's what the neoplasm is. And anything that is new, guys, that's like it doesn't seem normal, doesn't look normal, okay? That all of a sudden one day you wake up and you see, a lesion or an abnormal tissue popping up from your skin. That is a neoplasm. May not be what we call malignant, but it's something that is new. Sometimes a suspicious mole, okay, that all of a sudden, you didn't have it yesterday, and then you wake up the next morning, you saw that new growth, or you notice, hey, this I didn't have this like 2 weeks ago. Now you have it, right? So that's what neoplasm means. Now, neoplasm, guys, as we now know, is a form of cancer. Now, cancer has different behaviors, right? And what are those behaviors of neoplasm? And we're going to go into that. Okay. So remember that, guys, neoplasm is new growth or tumor or cancer. Okay. In our book, they term it a little bit fancy, but it's actually cancer. When you see a documentation doctor saying patient has this neoplasm of this body part, that means patient has cancer of this body part. Okay? So neoplasm is a tumor, is a cancer. Now, what are the different behaviors of cancer? So these are in the book, at least, guys, right? You have this different behaviors of cancers. And what are these? Of course, the most understood, most common one is malignant, right? When we say the patient has a malignant cancer, first thing comes to mind is that, of course, it is not something that you really take lightly, because a malignant cancer is a serious condition, right? A serious condition, meaning that a patient might, if not treated right away, might end up losing his life or their life, right? So that's what malignant means. Malignant means it is an aggressive type of tumor, right? Now, yeah, so malignant is an aggressive type of cancer, aggressive type of tumor that, if not treated, if not addressed right away, the person might lose their life. Okay. So what are other behaviors of cancer? Metastatic. When you say metastatic, guys, this is a type of cancer which is mostly malignant also, that had already maybe all metastatic are malignant, right? So, I mean, when you say metastatic, that means you say it has already spread to a neighboring site or other site. It has, the cancer cells has traveled from the primary site, it has traveled to another site by means of course, cancer cells also are say supplied with this oxygenated blood, right? And the blood circulates in our system. So when the cancer cell goes through the bloodstream and goes to another site, then there's a big chance that a patient may develop this, what we call a secondary or metastatic cancer. So that's what these type of behavioral cancer is, meaning that from one side it had already traveled to another side. Okay. So metastatic, again, remember this word, guys. Metastatic means secondary, okay? Secondary, or it has already migrated that cancer cell to another side. Benign, everybody knows what benign is, right? When you talk about benign, it is not, it's not very worrisome, right? It's not so not so be feared about, right? Because it's benign, right? It's not, we have many benign tumors in our body, right? So, I mean, like a suspicious mole sometimes, will just, it just pop up, in one part of the skin, but it can be removed. Go as we age, guys, there's little, there's, little growth here and there that appears in our skin, and skin is the largest organ of the body, and we, I don't know if you guys realize that skin is the largest organ of the body, and it is subjected to, of course, to external different external factors, and that is because that's a reason why it is very predisposed or susceptible to developing this type of the skin disorders, right? But benign means you don't worry about it because it's not aggressive. What about in situ? In situ means this is a type of cancer that is pretty much contained in one area. Very, it's locked in one area. In situ, from what I understand, for the most part, is a benign type of neoplasm, benign type of tumor, right? So it's pretty much like to stay, it's staying in one specific area. That's what in situ, from how I understand it. Okay. What about, and the other behaviors unspecified and unknown, which I'm not going to talk about this too, guys, because it is not, I mean, I haven't really come up with or met a doctor saying or documenting cancer is unspecified. Okay. If the doctor does not is not very certain of the behavioral cancer, the doctor will just say patient has this cancer. Okay. I have not seen a documentation yet saying this is an unspecified behavioral cancer. So don't worry about those unspecified and unknown, because you might probably not encounter. I've been in this business for 13 years now. 13 years, 2011. Yeah. 13 years, I have not seen that type of documentation. And you might not see that kind of language as doctor used to, like unspecified or unknown behavior cancer. So when the doctor documents cancer and he's not is not certain of the behavioral cancer, the doctor will just document patient has this type of cancer or cancer of this organ. Now, an unspecified type of cancer, if the doctor uses that language like unspecified or meaning like the doctor did not further describe what kind of a cancer it is, you always assume it is malignant. Okay, you always assume it is malignant. So let's, for example, the doctor, you're reading a patient's chart and the doctor says patient has breast cancer, patient has cancer of the uterus. You always assume it is malignant. Okay, because if it's not malignant, the doctor will say patient has a benign cancer of this. Okay, so don't worry about unspecified, don't worry about the unknown, because you're not probably going to see it in your lifetime. I'm not so sure, but if you work in an oncology department, you might probably see it, but I still doubt it. I strongly doubt it. If you know someone, a coder guys, who has encountered a doctor saying the doctor documented unspecified or unknown, let me know. I want to know. I want to meet that coder. Anyway, so enough of that unspecified or unknown behavior. But to sum it up, guys, you need, as coders, you need to be familiar with this different behaviors of cancer. Okay. Again, what are those? We have already mentioned. First one is malignant. Okay. Primary malignant, meaning it is aggressive type of tumor or cancer. Next one is metastatic, meaning that the cancer has already traveled or migrated to, the cancer cell has migrated to, when I say migrated, guys, it doesn't mean that the cancer cell is leaving the primary site, meaning that it has spread, the cancer has spread also to another site. That's what I mean by migration, because the primary site is not going to get, it will not say uh, it's not going to get fixed. Okay, what I'm trying to say is that it will not move away, or it will not go away. It's just the cancer cells. One of those, or some cancer cells, will just decide to move to also to another location or another site. The in situ means it's contained in one area, and lastly is the benign, which is what we call, sometimes we call it non-cancerous, right? That's what benign to many people means. Okay, so those are the different behaviors of cancer. Now, let's look at this terminology, guys, or this general rule about neoplasm. Let's read it, okay? The neoplasm table in the alphabetic index should be referenced first. However, if the histological term is documented, the term should be referenced first rather than going immediately to the neoplasm table in order to determine which column in the neoplasm table is appropriate. Okay, so let's break this down. What does this general rule of cancer is trying to tell us? Everybody knows now where the cancer table is, right? Or the table of cancer. So when you open your book, guys, um, to almost mid part of the book, not probably the very center, but sometime, somewhere, probably um, somewhere in the, let me see, where is that cancer table is? In my book, the neoplasm table, guys, or the cancer table starts on page 343. Okay, so if you go to your book, guys, when you open your book, it's somewhere, somewhere in the page 340 to 350, you will see this neoplasm table. Okay, so now this neoplasm table, the behaviors cancers that I have already discussed with you guys, you will see them in the topmost row of the book, right? The malignant, the secondary, the in situ, and benign and unspecified behavior. You see that in the top row. Okay, so the the guidelines that we just read, guys, about the general of cancer is that when you're looking for the cancer code, okay, the book says you use the neoplasm table, right? However, the book also says that if in your review of the medical chart, you see the histological term or the histological form of cancer, what does the book say? You have to reference that cancer first. What is those? What is this histological term? Okay, says you have to reference that first before going immediately to neoplasm table in order to determine which column in the neoplasm table is appropriate. Now, when you talk about histology, guys, from what I understand is this is the type of origin or this the minutest beginning of the cancer. What I'm trying to say is that it starts with this little cells or the beginning of the cancer, right? And which part of the organ does this cancer start from? That's what I remember. What I understand about the histology of cancer. Okay, now there are many different histological form of cancers, and let's try to determine what are these different histological um, forms of cancer. Okay, you guys ready? So every time you guys hear the term, okay, the term with an oma suffix. Suffix means the type of affixes that are attached to the last part of the term or the word. So let's say, for example, when I say melanoma, does everybody does anyone here not know melanoma is? What is melanoma? It is a skin cancer. Yes, Arthur and Manny says it is a skin cancer. Yes, skin cancer, melanoma, and starts with the word melanin. Okay. Okay, so melanoma, guys, is an aggressive type of skin cancer, meaning that this type of cancer has penetrated deep enough to the layer of the skin that produces the melanin. That's how I understand what I understand about this melanoma. Okay, and it has the invaded. Okay, that layer of the skin that produces the melanin. Okay, it is a very aggressive type of cancer. So melanoma is a skin cancer, and you notice, guys, this suffix here, oma, that's what I'm trying to say, that every time you hear this word, you see this term with an oma, chances are this is a a type of cancer, or this is histology of cancer. What else? Can anyone give me other types of histology of cancer? What else that you guys are familiar with? You guys familiar with carcinoma, right? Carcinoma. Okay. Lymphoma, yes. Lymphoma. See, you guys can really, okay, carcinoma, yes. Papillary carcinoma. Adenoma, yes. Adenoma. Okay. What else? Have you guys heard the word sarcoma, right? Sarcoma. What else? What about adenocarcinoma? Right? So these are the different histologies of cancers. Of course, we also have leukemia, right? Leukemia, although it does not start with, it's not does not end with oma, it is a cancer, right? What is leukemia, right? That's a type of cancer. Matter of fact, leukemia, I don't know if I'm understanding correctly. Leukemia um, is a cancer of the connective tissue also because it's a blood, right? Cancer of the blood. Now, again, I'm not so sure. I'm just trying to like connect, um, some terms that I understand. Oh, myeloma. Yes, myeloma is also um, type of cancer or histology of cancer. So everything here, guys, you guys get the point, right? When you hear the word OMA, means these are types of, or these are histology of, different histologies of cancer, okay? Carcinoma, from how I understand it, is a carcinoma is a type of cancer histology that starts in the what they call is the epithelial cell. Epithelial cell, from how I understand it, is that this is a type of cells that um, attack or begin from, the outer layer of an organ. Epi means top, right? So these are the type of cells that cover the outer layer of an organ. Like, when you go to a marketplace, right? And you look at the different organs, body parts of animals, right? And you see that white, almost whitish, thin covering of the organ. From how I understand it, that's a epithelial, level or layer of the organ. So if the cancer starts from that, again, guys, you can research it, you can look for it, but what I understand is that is the type of cancer we're talking about. It starts with that part of the uh, of that organ. Now, lymphoma is a cancer of what? Lymph nodes, right? When when the cancer starts attacking our lymphatic system, if epithelioma, right? Epithelioma is a type of sarcoma. That's how I understand it. Thank you, Arthur. Yeah, so if you guys have a formal medical, medical background, you know what I'm saying here, right? So lymphoma, again, is a type of cancer that starts with our lymph nodes. So we have our lymphatic system, is guys, is scattered all over our body. Now, if there's a cancer of those lymph nodes, that's what I how I understand it's a lymphoma. Adenoma, guys, is a benign type of cancer. Adenoma. So, I mean, I have already explained it earlier. That's nothing to worry about for now, right? Because most adenomas are just an excessive, growth of, abnormal growth in anywhere in the any organ. So that's what adenoma is. Okay, we have, what about sarcoma? Sarcoma from fibroma, yes. Sarcoma from what I read is that sarcoma is a type of cancer of the connective tissues, right? So it can be as cancer of the bone, cancer of many body parts that have connective tissues, right? So that's what sarcoma is. Most sarcomas are bone cancer. Maybe, I mean, if talk about sarcoma, usually it attacks the bone. That's what sarcoma, from what I understand. Adenocarcinoma is okay. Adenocarcinoma, from what I read, from what I gather, is that type of cancer that's specific to organs that are that secretes different types of say excretions, right? So like our pancreas, what else? Um, our thyroid, right? Those are the different types of adenocarcinoma. So these are the cancers that usually start in the endocrine system. Okay. All right. What about leukemia? Everybody knows what leukemia is. Leukemia is a cancer of the blood, and myeloma is a cancer of the plasma, bone marrow. That's what I understand about myeloma is. Okay. Now, again, I'm not a cancer expert. I'm a coding expert. That's why I'm not going to talk about really, in an extensive and more detailed fashion, these different types of cancer. I'm talking about a more layman term, a layman, in a layman form. All right. Now it is, of course, I give you that liberty or responsibility to look further, guys, to study more about these different histologies of cancers, because that will really help you in identifying the proper code, the right code for a very specific type of cancer. Okay. Now, so we have talked about this different histologies of cancer, guys, right? This is the how the neoplasm table looks like. When you go to your neoplasm table, the top row would most likely, or not most likely, the top row would look like this. Okay, so you have the first column here, which is for the body part or the organ, and you will see, right? You will see the different body parts here, and you have the codes for different behaviors of cancer. Look, guys, my example here is intestine. If you go to intestine, large, okay, these are the codes that you will find. The malignant primary is C18.9. The secondary and malignant is C78.5. Cancer in situ is D01.0, and benign is D12.6, and so on and so forth, guys. Okay, I'm just showing you guys how the cancer table looks like. And when you have your book, of course, everybody has their books, right? When you have your book, it is a very simple process, right? Go to you go to your neoplasm table, look for a large intestine or whatever that organ that you are looking to code for, and look for, if the doctor says patient has cancer, this. So you go to the primary because, again, guys, most doctors don't document the unspecified or unknown. If the description of the cancer or the behavior of cancer is not documented, assume that it is malignant primary, okay? So malignant primary is the primary site. That's what malignant primary means. If the doctor says patient has colon cancer, it is malignant primary cancer of colon. Patient has breast cancer. This is malignant primary of the breast. Okay, so that's how this coding works. So you look for that body organ, and then you cross-match the code to the what the top column says. If it is primary, cross-match it with the body organ or the body part or organ, you got your code right there. Okay, and of course you always check the tabular, because the tabular says more, or says something else, or sometimes the tabular has a different instruction or more instruction for you to complete the code. Okay. So that's your neoplasm table or the cancer table, right? Now, this is the histology of neoplasm that we were talking about earlier. Matter of fact, let's read it. What does vocabulary.com say about histology of cancer? Those OMAs that we have enumerated here in my whiteboard here. So histology says is the scientific study of the tiniest cells that make up plants and animals. If you're interested in histology, you need to get a microscope. So this is what I meant about you really it starts with the most or the tiniest part of of the cell, the molecule, or the most granular detail of that tissue, right? So that's what histology means according to vocabulary.com. Okay. Now, histology cancers, we all have this. Okay, so I didn't realize I have this in my presentation. So we can pretty much read it right now, guys. Carcinoma, I tried to explain it. I didn't realize I had it here. So it would have been, I could have done myself a big favor if I further scroll down, right? So carcinoma is a type of cancer that starts in cells that make up the skin of the tissue lining organs, such as the liver or kidneys. See, guys, so my explanation earlier was, the outer layer or the top covering of an organ is where this carcinoma starts from, right? So I'm not too far away, right? So what about sarcoma, a type of cancer that begins in the bone? Yes, I did say that, okay? Or in the soft tissues of the body, including cartilage, fat, muscle, blood, fibrous tissue, or other connective or supported tissues. So sarcoma, remember the guys, sarcoma, bone, usually when I hear sarcoma, the next, the first thing comes to mind is bone cancer to me. Lymphoma, cancer begins in the lymphatic system. So we're right about that, guys. Melanoma, now we all know melanoma. Everybody knows what melanoma is, right? Skin cancer. Adenocarcinoma is a type of cancer that forms in the glands. There you go. So glands are the body parts that do this excretions or secretes, right? These are the cells that secrete substances with the body of or excrete them from the body. So we're right about adenocarcinoma. Another type of cancer, glioblastoma. This is a very aggressive type of brain cancer. Look, guys, it's a type of cancer that starts or as a growth of cells in the brain or spinal cord. So this is a really, really serious type, aggressive type of cancer. And leukemia, everybody knows what leukemia is. Type of cancer that affects the blood and bone marrow and is characterized by the production of normal white blood cells. Okay, so these are your histology of cancers. Now let's go to talk about the guidelines of cancer, guys. Okay, let me read. If the malignancy is chiefly responsible for occasioning the patient admission, encounter, and treatment is directed at the primary site, designate the primary malignancy as the principal or first listed diagnosis. Take notice again, guys. The guidelines always emphasize this language here, malignant or principal or first listed diagnosis. It is too important that coders should not miss. Okay, so the rule is, okay, the guidelines that we just read, guys, saying that if the treatment is directed to that type of cancer, okay? So there are times when you're reading or reviewing a patient's record, guys, there are patients who have multiple cancer, like cancer of the brain, cancer of the bone, cancer of this, right? Now, if this patient comes to the clinic and what is being treated in the clinic is this type of, or this cancer, this specific body site, right? Assign that as your principal diagnosis. That's what the guidelines actually is trying to tell us. That, you always default to that mindset saying that if the patient's visit to the clinic or having say for example, patient's having a removal of that tumor, right? And that tumor is in the breast. So your primary diagnosis should be the breast cancer. So it's that simple, right? So if the treatment is directed to that site, assign that as your principal diagnosis. Okay? Now, let's continue. The only exception, okay, listen here, guys, and listen good. The only exception to this guideline is if the administration of chemotherapy, immunotherapy, or external beam radiation therapy is chiefly responsible for occasioning the admission or the encounter. In that case, assign the appropriate Z51 code as the first listed or principal diagnosis and the underlying diagnosis or problem for which the service is being performed as a secondary diagnosis. Okay, so you have to pay attention here, guys, about this exception, okay? What are these exceptions that are being talked about here? So if a patient is in the clinic or scheduled to have this type of therapy, what are those therapy? Chemotherapy, radiation therapy, immunotherapy, brachytherapy. So there are many modalities of of cancer treatment, guys. If the primary purpose of the visit is to have for the patient to have that type of therapy, the guideline says assign the code for the therapy as your principal diagnosis, as your first listed diagnosis. So what I'm trying to say, what the guidelines are trying to say is that, hey, yes, I get it. Patient has cancer, right? Patient has a ovarian cancer, okay? But if a patient's main purpose of the visit, right, is getting that therapy, chemotherapy, right? If it's that the patient's main business or main purpose of the visit, assign the chemotherapy or that particular therapy as your first listed diagnosis. Does that make sense, guys? and whatever that the therapy is for. If it's ovarian cancer, assign ovarian cancer as your secondary diagnosis. Any question, guys? Does that make sense? Everybody understands now, right? What I'm trying to say here, because the guideline is very explicit, saying, I know, if the visit is to treat that cancer, right? Whatever that cancer is, the default is assign that cancer as your principal diagnosis, except if patient is having these different types of therapy. Does the guideline again continue with this? When a patient is admitted because of a primary neoplasm, okay, with metastasis, and treatment is directed toward the secondary side only, the secondary neoplasm is designated as the principal diagnosis, even though the primary malignancy is still present. There you go. So look here, guys. The example that I gave you earlier is that this patient has has cancers of multiple sites, right? So the guidelines is talking about this type of scenario where a patient has a primary cancer and at the same time also has a metastatic cancer. If the treatment during that visit is for the secondary or metastatic cancer, what does the guideline say? That secondary or the metastatic cancer should be assigned as your principal diagnosis, even though patient has a primary cancer. You see, guys, it always defaults to what is being treated right now. Is it the secondary or is it the primary? Right? So just make sure, guys, that you understand the flow of the chart, right? Saying, if the main visit, sometimes, the reason for visit, you automatically see that in the top portion of the chart, because the top portion of the charts always tell you why patient is in the clinic. If you read the top portion of the chart, the first three sentences, you see what the patient is complaining about. So you're not gonna miss it.